The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, board-certified periodontist, Dr. Jividan. Dr. Jividan, welcome to the program.
Thanks for having me.
Let's begin with your background and training. I said you're an expert on the topic. How long have you been in and around dental implants, by the way?
I've been a periodontist for 24 years.
24 years. What is that specialty, periodontist?
A periodontist is a dental specialist in the diagnosis and treatment of diseases of the supporting structures of the teeth, namely the gum tissue and bone tissue, and also in the planning and placement of dental implants.
All right. Now, you also are board certified in oral implantology.
Yes, there's an organization called the American Board of Oral Implantology that attempts to certify a specific level of expertise in the field. And in fact, they're trying to establish implantology as a recognized specialty with the American Dental Association, which it is not currently.
Okay, but it's additional training.
That's correct. There's only a few hundred individuals in the United States that have that certification.
That have gone through that. Now, I always tell people, they say, Randy, who do I see for this and who do I see for that? And I always say, look for a specialist. And we talked off camera that, you're a periodontist, that it's about the same price wherever you go to get dental implants, whether it's a general dentist or a specialist.
Yes.
Is that fair to say?
Yes, I tell people that are looking for a dentist to perform implants in a given area. I have to say that I'm biased towards them seeing a surgical specialist in a recognized surgical specialty such as periodontics that also has additional credentials, perhaps being board certified also in dental implants.
Now, in the town you were in, we talked on the phone. Your high school, a couple blocks
yes,
away.
I've been basically in Dayton most of my life, and ended up actually practicing just a few miles away from where I went to high school.
And did you ever see high school friends that come?
Oh, yes, I do. I see friends and family, and we always talk that Dayton's such a small town. If I don't know somebody, I know somebody who knows somebody, and I've treated children of patients of students that I graduated with.
How are dental implants or getting dental implants better now than they were, say, 10, 15 years ago?
Well, dental implant treatment has advanced by advances in implant design, use of more sophisticated imaging techniques such as in-office CT scanning, just having clinical trials that have shown that we can actually put crowns or teeth on the implants sooner so they can be eating sooner. And then we come in combination with sedation techniques so we can actually treat them with minimal apprehension.
So you do IV sedation?
That's correct.
Now, not all periodontists do IV sedation. Is that right?
Right. There's additional training that dentists have to go through to become certified to be able to do IV sedation. The big benefit of IV sedation is that patients that have heretofore been scared to go back to the dentist because they're scared of pain, of injections, and at least remembering all that, we're able to treat them in a manner that they don't even remember, having treatment.
So it's safe, IV sedation?
Oh, yes, it is.
Is that a big part of your practice? People say, I want...
Oh, yes. I mean, you could place an implant with the so-called Novocaine or local anesthetic, but when that's combined with IV sedation, it leads to, I hate to say pleasurable experience, but something close to that.
Okay.
And when they don't remember anything and they think that a 2-hour procedure is only 20 minutes long, I mean, you can't really argue with those type of benefits.
But they sound very painful. I mean, the process must be painful.
Yeah, the concept of drilling into the bone and putting a screw in the bone certainly sounds horrible.
Okay.
But the truth is the opposite, is that it's probably one of the least painful procedures that we do, and patients are pleasantly surprised by the minimal amount of pain and the fact that when they do have some discomfort, it's typically controlled with medications such as ibuprofen.
Really? So the next day, what do they say?
They typically, when they come back in for their next visit after surgery, I asked them how much pain medication. They said they usually took a few ibuprofen, and that was it.
What about age ranges of people getting dental implants these days?
Oh, we see patients in their adolescence that are maybe congenitally missing teeth, to patients, my oldest patient was 92 years old that I placed implants in.
Why would a 92-year-old want to get dental implants?
Well, she was wearing a partial that was grabbing onto a couple of teeth that actually broke off, and she told me that She said, Sonny, at my age, I have two pleasures in life, and that's talking and eating, and I can't do either one the way she was right at that time. So I placed a couple of implants so that she can have a denture that snaps in and snaps out, and she was very happy with the result.
After you get implants in, how soon can you eat?
Typically, you can eat a softer diet right away. Okay. But most of the time, there is a period of time where you are on a softer diet before you actually end up chewing.
Like a few weeks out?
Typically, a person's on a softer diet for a couple weeks, and then they can gradually chew.
Eat meat?
Right, depending on the exact clinical situation, they can be able to chew harder foods as the healing process is.
Now, and knowing that I was going to have a periodontist here today, I've asked around, and a few people say, well, it takes about a year, though, is the big problem. And I talked to you on the phone. You said that's really not the case anymore. Yeah, why is that? I mean, help me understand, why is it quicker now?
Well, that's a misconception. There are some unique cases that need bone addition before you place the implants, and some of those can take up to 10 months, 11 months, maybe up to a year. But the vast majority of cases can be treated in 3 to 4 months.
So that denture wearer that's watching this, maybe they're in their 60s, 70s, which is very young today, that could be, few visits.
Absolutely.
If everything goes right?
Right. There's some procedures that we can combine. Some dentists may choose to do a very staged approach where they take out the teeth, wait a few months, and certainly that lengthens the period of time. One thing that we do many times is take out the teeth and put implants in on the same during the same appointment that we take out the teeth.
Okay, and how soon could they be chewing there? Again, soft food right away?
Soft food right away. They usually get some sort of denture, but usually a softer diet for at least a few weeks, and eventually they can have full function when the new dentures are made about 4 months later.
Okay, you say, and I've got a lot of questions for the about the denture wear and how they could benefit. But you say you're changing people's lives, and you brought some photos. So what am I looking at there?
Well, you're looking at a patient that has an existing upper denture that he has no complaints with. He has lower teeth that have decay, has periodontal disease, and some soreness, and for which that we don't have any options except to take out the teeth.
Okay, so those teeth had to go.
Yeah, he didn't have a choice. We again, as I said before, we try and save teeth when we can, but it really wasn't possible in this particular case. So we had to take the teeth out, and he didn't have any options to save his teeth. However, once the teeth are out, which has the advantage of stopping periodontal disease definitively.
Okay. Which is what? That's the gum disease?
That's the gum disease. That's the infection. That's correct. That's an infection. That's a painless infection around the teeth that resorbs bone. Again,
so
usually
when
it's painless.
You remove the teeth,
yes,
the infection goes away.
That's correct.
Okay.
And we were able to place a couple of implants.
So that's a lower, I'm looking at the lower jaw?
You're looking at the lower jaw with 2 implants for a denture that can snap in and snap out. It's retained by the implants themselves there. And you could see that the gum is healthy. There's no evidence of periodontal disease.
It's hard to believe that's the same gums.
It's the same patient. He's able to wear his lower denture. It doesn't move around anymore. In fact, this patient is probably, I think I did treatment on him over 5 years ago, and I do see him for checkups in fact, I saw him last week, as a matter of fact. Okay. And he told me it's something that he never regrets not doing it. He's just so thrilled with the
so
result.
This is, okay, so you put the implants in the bottom,
yes,
and then they have like a snap in,
right,
snap out.
Right, it kind of clicks in place, and they're able to, it provides substantial stability to their denture that they never had with the denture. In fact, we were able to take his teeth out and put the implants in the same day, as I may have mentioned.
Same day. Okay, now you say that you use a test drive example, that if everybody were to try this out, like denture wearers came in for a tryout, they couldn't go back.
Yes.
Elaborate on that.
Well, there's, compared to having no teeth at all, or having a lower denture that doesn't have any implants, to test drive an implant for a weekend and come back and say take the implants out, I would have no patients that would tolerate me taking their implants out.
But if it's as good as you say it is, okay, and would you say there's thousands in Ohio that are denture wearers, upper lower denture?
Around not only in Ohio but around the world, it's thought that if everybody came in for denture treatment, dentists would be bombarded with patients, would be able to treat everybody. Okay. There's tons of people that need this type of treatment.
Okay, but if it's as good as you say it is, why aren't they all doing it? If just 2 dental implants can give somebody something that's fixed, or snap in, snap out, why don't they do it?
Oh, Randy,
What's your take on that?
A couple of different reasons. One is I don't think they're aware of the options, but I also suspect that these patients are so tired of going to the dentist. They've spent a lot of money with their existing teeth. They've had filling after filling, then a root canal, and then sometimes the root canal tooth breaks, and they have infection from that, and they get to a point where they have a few good remaining teeth, and they're just so relieved just to have their teeth out.
So the last thing they want to do, I guess, is to go back to the dentist.
Right, and then they're with some of the fear factor, on top of that, they just don't end up, they disappear from dental
So they don't
offices.
know their options. So denture wearers don't go to the dentist, I guess.
Correct. Once they have their teeth out, typically they disappear from dentistry. When you look at the after, you could see the lower teeth look better, and you could see that even when he smiles, and he's learning how to smile again. But unfortunately, being that he's had an upper denture for a very long period of time, he's lost some muscle tone in his upper lip, and that happens as we age naturally, but it happens prematurely when people lose their teeth.
Do these people come to you and admit things like they don't smile? Or that they're self-conscious, I guess, in dating situations or social situations?
That's one of the big reasons why people end up having implants. The social situations, the fact that people are living longer means that they're more likely to lose teeth and need replacements. Dating, eating, those type of social situations put a high level of psychological stress on these individuals that have dentures with no implant support.
You say that oftentimes denture wearers will tell you that they keep it a secret from the people they're dating or loved ones.
Yes, I mean, it's a very, very personal thing as far as having teeth that come in and out. I mean, to be able for people to especially for women that take their teeth out at night is a very embarrassing type of social situation. And so that leads them to look for answers such as dental
implants. Now, with the 2 dental implants for the denture wearer, still some adhesive in the back or somewhere?
You shouldn't have to use adhesive with dental implants. However, the use of dental adhesive illustrates the psychological problem with having dentures. I mean, there's $200 million spent at least every year buying the sticky stuff to hold your dentures in, because people are afraid of those psychological situations where their teeth may come loose or fall out.
Do they complain about the adhesive?
People don't like it. It's very, people do complain about it, but given their alternatives, if they don't have implants, sometimes they continue to use it.
When it's all said and done, what are they happiest most about? What do they tell you, the patients? After they've had the implants, maybe they have something snapping in, snap out. What are they happiest about?
The fact that they have the confidence that their teeth aren't going to move. They have confidence that they're able to speak better. That their dentures aren't going to move, and last but not least, that they're able to eat foods that they weren't able to eat before that, which on a long-term basis, they're able to have a better diet. They're able to eat more fiber, more fruit and vegetables.
Okay, interesting.
And that will translate into, it's not unreasonable to say that translates into a longer life and a higher quality of life.
All right. Is this one of those things where they say, I should have gotten, especially for the denture wear, should have done this years ago?
Absolutely. That's a common comment after treatment.
Is it the happiest group of patients in all dentistry, in your opinion, do you think?
Yes. They don't have postoperative pain. I explain to patients that a major reason for that is that there are no nerves in the dental implant, and therefore there's that would account for the fact that most of our patients are extremely happy with the results of treatment.
And they don't fall out. I mean, they're safe. I mean, if you decide with the imaging to put them in, they're going to stick.
They have a very high success rate. I mean, there are some very, isolated rare cases that where the implant doesn't take, so to speak, but that's extremely rare. In fact, in many of those cases, they've been told by other dentists that they've rejected the implant, and I found in those rare instances that another implant can be placed after a short healing time.
Now, can they go to you directly, or should they go and get a referral from their general dentist?
Well, unlike medical type of treatment where you have to have a special form to go to medical specialists, dentistry is much more open in terms of people can go to whoever practitioner they want to go to.
Interesting. So they could go to you.
Yes.
They could call you directly. You do the consult. Then you align them with the general dentist.
Yes. Many times they already have a dentist of record that we have probably already worked with.
Okay. Now we're going to take a quick break. We come back. I want you to take me through the process. I know you have a lot more photos.
Okay.
And specifically the different options for denture wearers.
Sure.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, what every denture wearer needs to know. We'll be right back. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. What everyone needs to know if they're missing one tooth, all of their teeth, and especially if they have a loose-fitting denture. With us, we have a specialist, board-certified periodontist, Dr. Jividan. Okay, now, as a recap, the categories of dental implant patients that you see. I mean, who should do this?
We see patients that are already missing one tooth or all their teeth. We see patients that come in with dentistry, broken teeth, that still have their teeth that need them removed for possible dental implants.
Okay.
And we see patients that, I almost call them emergency patients that have, for example, a front tooth that just broke off because of a root canal that went bad. So they still have part of the tooth in place.
I mean, is this a clear alternative to bridge work?
Oh, indeed it is, Randy. It's one thing that patients still are not aware of that option. In fact, the New York Times had an article about 3 months ago emphasizing the fact that implants are used for the most part in lieu of bridge work nowadays. So it's still...
Is bridge work temporary, by the way? Is it supposed to last forever?
It usually does not last forever.
Okay.
Here we have a patient right here. This patient is a young patient, a dental professional, and she's congenitally missing a tooth. As a result of missing that tooth, she wants to have a fixed replacement. Right now she's wearing like a retainer.
A fixed replacement is what? A
It's
bridge?
something,
Is that a bridge?
something that you don't take in and out. That's correct.
Okay.
Right now she's wearing a removable partial, and she doesn't like the fact that it's removable. It ages her.
All right.
And she wanted a dental implant, and after doing an examination, we determined that she did need some bone grafting ahead of time, but we were able to basically replace that single tooth with a
Nice.
with an implant.
Can't tell which one is which. But is there a preventive aspect to dental implants?
Absolutely. Otherwise the adjacent teeth on either side have to be cut down through the protective enamel layer, and that subjects them to decay. Maybe they need root canals at a higher incidence, and they are lost prematurely, especially someone that's in their 20s. If you look at the cost of replacing that tooth over a normal lifespan, you probably have to replace maybe 4 times at least. So not only does it look better, it actually saves costs in the long run to have an implant instead of a bridge. Here's another patient that lost part of their teeth. You mentioned categories of implant patients. This person still has some of their teeth in place.
So it was like an accident?
Yeah, it was a traumatic accident where he lost some portions of his teeth. Here's another example of that. And we were able to use specialized technique called the immediate implant placement, where we're able to take out the tooth root and place an implant in the same day, which saves time, which is one of the advantages we talked about, or advancements in dental
implants. Like a tooth in a day?
Well, they got part of a tooth in a day.
Okay.
But the final result, if you look at these pictures over here, is something that you can hardly tell.
So they look real. I mean, and they'll last like a regular tooth?
Exactly. And we didn't have to prepare the other teeth.
So this is an alternative to bridge work.
Right, and it actually prevents a cascade of events which can end up leading to complete loss of all their teeth. People are typically lose their back teeth first, and then they have a bridge made. And then over a period of time, one of the bridge teeth breaks down. So now they have another bridge made that has more stress on the adjacent teeth, and then those
like
one
a
of those
snowball.
Exactly.
Very interesting. Okay, so are you saying though that, and we're running out of time, but when people are missing those back teeth, they specifically need to get dental implants to slow or stop this tooth loss?
Exactly. Otherwise,
Really?
they're going to end up. If they had partials made, the partials can cause damage to the teeth that are clasped by the partial.
Okay.
Another example would be this patient was referred by a prosthodontist because he was not sure whether some of these teeth can be saved or periodontally treated. After talking to the patient and seeing what her desires are, it was deemed to meet all her needs, we would take out the rest of the upper teeth, and she would need a denture. But she didn't want to have the denture cover the roof of the mouth, which covers taste buds, and she loses the sensation of feeling her food, feeling a different temperature of the drink she wanted to drink. So what we ended up doing is putting several implants in the upper jaw.
So what is that I'm looking at?
What you're looking at is a picture of the upper jaw. You're actually seeing the fact that dental implants don't necessarily look like teeth. In this particular instance, the bar and those little balls on the end of it help hold the denture up.
So something snaps on top of that?
It snaps on top of that. Typically, the upper denture is held in place by a suction. But because that the denture in this case is cut out, otherwise the denture would just flop down.
So the roof of the mouth is
correct. Correct. That's one of the advantages of having implants. It also helps preserve the bone.
So how many implants, by the way, for upper? To get something that's really
an
strong?
absolute minimum of 4, typically 6. and maybe more if they want teeth that don't come in and out, maybe up to 8 or 10 implants. This patient now, she's happy that she can eat. She can eat foods without having the pain and discomfort of the teeth that she had previously. Also, she's very pleased with the aesthetics or cosmetics of the result.
Yeah, looks good. Looks good.
A similar example would be someone that started out like this, unhappy with his appearance. He also realized he had pain, which is sometimes not a common thing with periodontal.
Hurts when you chew?
He had pain. He had periodontal disease, and he also had some dental decay. You can see by the dark spots on on that. And we performed periodontal treatment that allowed him to have crowns on his upper teeth. And we also did implants to help hold his lower denture in place. So this is an example of periodontal treatment planning to help people keep teeth when possible.
Okay, okay. Now fixed. Is that this one
yes,
that you're
yes.
showing? Okay.
There are some individuals, we talked about the 2 implant snap in, snap out.
For the denture wear.
That's correct. But individuals that have been away from the dentist for a long period of time, they may start having pain later on in life because the bone has resorbed over the nerves in the lower jaw such that the plastic is actually pressing on top of the nerve.
Oh, okay.
In fact, there's I think about 17% of people that have dentures don't even wear the dentures because of various reasons, including pain.
17%.
And it's very unfortunate.
So there's nerves where? So the nerves
in the middle part
they
of the lower jaw.
become exposed over time?
Yes, they end up being right underneath the gum, and it's just like, literally pressing on a nerve when they bite down on their dentures. So those type of patients, not only it's almost mandatory that they have a fixed type of teeth that do not rest on the gum tissue, and as a result, they do need more implants. They need more than the 2.
Like how many?
Typically 5 implants.
So 5 implants, and you get your teeth back.
And these patients are one of the happiest group because they have something that mimics what they had when they had their own teeth.
Isn't that what everybody wants? I mean, with a choice between something snapping in, snapping out, I mean, a few more implants,
yeah,
you get something fixed.
Last time I checked, it wasn't really considered to be a normal anatomical feature to be able to take out your teeth. I mean, most of them, they're anchored in the bone. So why should we treat patients otherwise?
But is that the goal, to get something? I mean, everybody would probably want something fixed.
Yes.
Teeth that don't come out.
That's correct. That is the
ultimate
ultimate goal.
What about chewing? I mean, can they eat
their chewing gets to be almost as good as it was to start out with, if not better. I mean, when people lose all their teeth, their bite force decreases by 50%. And so when they have dentures, especially the fixed dentures, they're able to recover some of the, if not most, and sometimes exceed their initial biting forces.
You do IV sedation.
That's correct.
And you also do oral sedation.
Yeah, we do.
What are the benefits of IV sedation?
Well, IV sedation.
Regular?
Well, it's a more controllable situation. I mean, when someone's taking something by mouth, you can never be sure exactly how much of that is going to end up into a sedative effect.
Okay.
And so you can actually you can actually what's called titrate or give small amounts until you get the effect that you're looking for, and it's a very safe technique. In fact, I would argue maybe even safer than oral.
You do these every week? IV sedation?
Several times a day, sometimes.
Is that right?
Yes.
Now, we are just about out of time,
Okay.
but frequently asked questions. I mean, what do they want to know? They're in the consult room with you. You do the consults.
Yes.
Is that right?
Yes.
What do they want to know? I mean, somebody coming in for dental implants.
Well, the primary one is pain. They're worried about pain, and when they're told that we're able to do this with a combination of local anesthetic and typically sedation, that aspect is easily, patients accept that very
So the procedure,
well.
obviously, they're not going to feel.
Correct.
Are they
Correct.
worried about the downtime pain afterwards?
The downtime pain, that's a great point. They are surprised when I say in many cases they can go to work the next day.
Really?
Most of the time any downtime may be as far as for the rest of the day, where I tell them that they need to be taken home to recover from the sedation.
How soon could
the
they
recover from the sedation takes longer than recover from the effects of the dental implant treatment.
Now,
lots of
how
times.
soon can they start eating? I mean, in an ideal situation. So a denture wear goes in, you've got the CT, you have what you need, you've aligned with the general dentist. How soon can they eat? And how soon do they have teeth on top?
Most of the time they have a temporary denture in place, and they're able to eat soft foods right away, so they don't have to be on a liquid diet or anything like that. One of the questions that comes up frequently is cost. I mean, people that are missing all their teeth think that they need an implant for each tooth. And in fact, that, as I mentioned earlier in the show, that we can replace a whole arch of lower teeth with 5 implants. So they don't necessarily find it as costly as they think it is.
So the 2 implants, snap in, snap out, is kind of the entry level.
Correct.
For somebody that, but does it make that big of a difference though?
In
the
terms
denture
of
wearer's life? Chewing, eating?
People that have had a denture for a long period of time get a dramatic effect with the two. People that have had a lot of their own teeth and they end up having to lose a lot of their own teeth, they tend to be more satisfied with the fixed type of teeth.
They like to have all their teeth back.
Right. They like the firm.
No, and the other question that comes up, in my mind is, do I qualify, or am I a candidate? Am I too old? Because my mother says, she's 73, she's too old.
If a person's healthy, if some people are told if they're diabetic they can't have it, the key thing is whether they're controlled diabetic. In fact, it's probably rare that a person is not a candidate than as opposed to assuming that most people are. Some people do need bone grafting, and if you go to a dentist that knows how to do that, they're able to take someone that normally wouldn't be a candidate and make them a candidate for implants by adding bone.
We're out of time. Final message. Somebody watching this, maybe they're even a bit skeptical. The denture wear, what do you say to them?
Well, they really need to get to their dentist and find out about the possibilities that implant treatment if they can be benefited by implant treatment before they start having problems. Because when they start having problems, they may end up being a more complicated case.
Like soreness and things like that?
Yes. The gum gets thinner as the denture tends to wear on the tissues, and they start losing.
So if somebody's in dentures 30 years, they still could be candidate for dental implants? I mean, they have enough bone left?
Typically in the lower jaw they do. But the thing is, you don't want to end up getting to like that patient we talked about where they actually had exposure of the nerve because they've been in dentures too long.
But when you do the bone grafting, and this is part of your specialty, I mean, is it from the hip? Where are you taking?
Typically from inside the mouth. We typically use a person's own bone, and that's a whole subject for another discussion. But I would say that there been refined techniques in that particular area to be able to improve the zone for dental implants.
I want to thank you for coming on the show. Very interesting.
Thanks for having me.
If they want to find out more, they can call your office directly.
Yes.
And get a consult.
Yes.
And get started. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.